You'll begin to stand and walk within hours after your surgery to ensure your safety when you go home. With the help of your physical therapist or PT, you'll be shown how to transfer, walk safely, and how to get in and out of a car. You'll use a walker or crutches to do this safely. Before returning home, you'll need to be prepared and a caregiver will need to help you. Make sure, once again, that your home is safe and free of hazards before you return. If you've had a total knee replacement, please be careful how you position your knee when you're not exercising. While at rest, please try to keep your knee straight and use a pillow to elevate your leg above the level of your heart to reduce pain and swelling. If you have an upstairs bedroom, you may want to consider staying in a downstairs room if possible for the first week or two after surgery to limit stair climbing. All stairways used should have at least one stable railing for safety. You'll be walking with crutches or a walker at first. Don't get up by yourself at any time during your recovery. To avoid injuries, slow down. Think before you move. When you get home, walking frequently is a very important part of your recovery. Once our team determines that you're safe to walk, you'll be encouraged to walk several times per day at home with help. Walking helps to prevent blood clots, reduces constipation, and ultimately can help you recover faster. By applying the techniques and skills you learned in PT to your exercise routine at home, in time, if you're careful and consistent, you'll regain strength and confidence in your hip or knee replacement. Make sure you attend follow-up visits as directed. These visits are important as you heal and allow you the opportunity to ask questions. Your caregiver is encouraged to join you at visits and therapy sessions to help you in your recovery. Before your partial or total joint replacement surgery, you were in pain and your activity was limited. Now, you're closer to regaining your life. It takes time, effort, and commitment, but it's worth it. And the Duke Total Joint team is with you every step of the way.